On behalf of the Area Agency on Aging of Pasco Pinellas, I welcome you to Aging on the Suncoast. The Medicare annual election period is a critical time for Medicare beneficiaries to review their Medicare coverage. To assist in this process, free, confidential, and objective counseling is available to Medicare beneficiaries, to their caregivers, and their family members through the SHINE program. For over 20 years, the Department of Elder Affairs SHINE program and their volunteer counselors have provided this essential counseling service, empowering Florida's older and disabled citizens to understand and to maximize their health care benefits. On today's program, we have two guests to tell us more about SHINE and about Medicare. Janet Mills is the SHINE Area Coordinator for Pasco and Pinellas counties, and Charles Frankel is the local area coordinator. Welcome back to Aging on the Suncoast. It's so good to have you again this year to talk with us as we enter the annual election period. Janet, share with us more about what SHINE is.
SHINE is, the word SHINE is an acronym, and it stands for Serving Health Insurance Needs of Elders. And it is, as you said, a 20-year-old program, and we help people with their enrollment issues, with billing issues, with prescription drug issues, a myriad of different concerns that people have as they try to weave their way through the insurance system. And it is totally unbiased, and we receive a lot of training, and we have training, then a mentoring program, and constant updates and information, and it is a very rewarding program for.
The counselors are generally volunteer counselors in the state of Florida, and they go through extensive training because Medicare and health care is a complicated field of knowledge.
That's right.
I understand that the SHINE program is funded by CMS, by Medicare, the Centers for Medicare and Medicaid Services. So it's a national program, isn't it, Charles?
Yes, nationally it's known as SHIP. So if you see SHIP, that is SHINE. In Florida, we call it SHINE. Other states may call it SHIP or some other thing they've decided reflects their area better. And the training and information is similar throughout.
I noticed picking up a Medicare and You handbook, that handbook that goes out to Medicare beneficiaries annually. I was interested to see on the back cover the telephone number that they list there for Medicare assistance is actually the number that will reach the local office.
Yes, and that is a number good anywhere in Florida. It's one of those smart numbers. Depending on your area code on your phone, it will direct you to the right area. If you have the wrong area code on your phone, they can help you get to the right office, I'm sure.
And during this segment, we will be running the number that reaches our local SHINE office, so that if anyone wants to copy down that number and call us, they will get a hold of the proper people to assist them. We mentioned that in the opening, I talked about that your program will help people who are both Medicare beneficiaries who are over the age of 65, but also people who are disabled. Tell us about that, Janet.
Yes, if a person is under the age of 65, which is the normal enrollment date, the first day of your birth month when you turn 65, Social Security disability clients are after the normal course of events is after 2 years of being on disability, you are eligible for Medicare. And it is a wonderful boon for those people that have insurance
so important.
that they need so badly. Yes. So, and we help all of those people. Anything that is Medicare related is our venue.
Okay. And I understand in Pasco and Pinellas County, which is the SHINE operation that you're involved with, you last year served almost 14,000 people. There were contacts with that many people, and that your core of volunteers was chosen as the group that received the state award as being the best group of volunteers. So I'm
pretty proud of that, and second year in a row.
Congratulations. And the quality of information is so important when you're dealing with health care. And particularly now we are getting to the annual election period. Charles, tell me, what is the annual election period for those who may not be familiar with it?
It is the time when, if you already have Medicare, you can review your plans and switch if you decide to. So if you have original Medicare and a drug plan, you can look at your drug plan, prices change, formularies change, you might want to review it and see if it's still the right one. If not, you can change. If you have an Advantage plan like an HMO or a PPO, you might want to review that and see if it's still the best one. Also, if you have an Advantage plan, you can go back to original Medicare and get a drug plan or vice versa. So this is the one time during the year when you can make those changes.
Okay, and the dates of the?
It's October 15th through December 7th, and that's going to be effective January 1st.
And if the decision that you make by December 7th is effective for the whole next calendar year?
It is effective for the whole next year. Now, there's a limited period up until February 14th. I don't know why they chose Valentine's Day.
We're remembering the date.
Where if you have an Advantage plan and find for some reason it just does not work for you, you can drop it and go back to original Medicare and get a drug plan. But that's about the only change you can make.
Janet, you have worked in this program for a number of years now. Are there significant changes that occur at this time of year that demand the attention of a Medicare beneficiary? Can you sit back and say, I've been with XYZ insurance company or a Medicare Advantage plan for 2 years now, haven't had a problem, I'll just stick with them?
No, it is very good to call a Shine counselor because we are unbiased. It's an education and advocacy program, and there are significant changes every year. Plans change their offerings, and they change. Some plans are dropped. It is a very good idea for the clients to call their doctor's offices and find out what plans they're going to be contracted with for next year, because those contracts can be dropped for various reasons too. So we take people through all of those questions so that we can help them.
You don't want to find out the 1st of January when you go to schedule your appointment with your doctor that he's no longer under the plan that he was last year.
That is not a reason to change plans. I mean, you cannot.
At that juncture, you can't change.
At that juncture, yes.
So
if during the year your doctor is dropped, you do not have a right to change plans.
So you need to make sure by the December 7th date, and having talked with Shine counselors during the annual election period, I understand don't wait until December 7th. You need to be starting to gather your information when the annual election period begins so that you can gather the information and then think it through and make a timely decision. The phones often ring in December and it gets very busy, and you don't want to make that type of decision in a crisis situation. You want to make an informed choice. When someone calls, and we will run the telephone number, when they call, they're going to get someone at the Area Agency on Aging helpline. They're not going to speak immediately to a Shine volunteer. How does that work, Charles?
Okay.
What can they expect?
They then forward that information to Shine, who will then, we have several counselors, and one of them will contact you on the phone. We try to take them in the order they come in, unless there's some severe emergency involved, in which, of course, we'll try to do that.
And that callback will be generally within a day, 3 days?
Yes.
Okay. A reasonable amount of time.
And we try, of course, we're going to get swamped during the annual enrollment period, so it may take a little longer, but we will certainly try to get to everyone as soon as possible.
If I'm calling a Shine counselor, I've called the helpline, I'm expecting a call back from a Shine counselor, what type of information should I have in front of me that will facilitate that conversation?
Yes, as I mentioned, to have the plans that your doctor or doctors are contracted with in common to the best of your ability, and your drug list, just the way you take it, whether you take the generic of something, how many milligrams, how many times per day, or the brand name. And also to have at the ready, in case we need to look into things a bit further for you, your name, your address, and your Medicare number and your date of birth, just the way Medicare has it at Medicare, regardless if you are enrolled in a Medicare Advantage plan. All that is very helpful to move the process on.
Right, because if this contacting with the doctor, if they haven't done that prior to speaking with you, it's going to delay your ability to assist.
That's
now
we
do
usually
have,
give them, we usually give them their homework at that point.
Okay. Well, and it is their decision to make. You cannot make that decision for them. You can just assist them in doing the research. What is it, when they call, they give the information, what is it that you what information do you provide to them? Do you go run the numbers and say this is the plan for you?
When we say run the numbers, what we do is we go to Medicare.gov, and in some cases the client is also able to do that themselves, and perhaps we can give them a little guidance on how to do it. But on Medicare.gov, when we have that information, it has all of the available plans, whether it's drug plans or Advantage plans, what the copays will be, what their drug costs will be, and we don't have the information on what doctors that you have to get separately.
Okay. Talk with me a little bit about the difference between, we're talking about MAPDs, Medicare Advantage plans, which are basically the managed care, where you're going to be within a network of providers, doctors, hospitals. Another alternative is to have a Medigap or a supplement policy, and then to have a Part D policy in addition to that.
Right.
If that's your choice, do you have to make those decisions during this AEP, between October 15th and December 7th?
Well, you can get a Medigap or a supplement policy anytime during the year. However, you can only get a Medigap policy only goes with original Medicare.
Right.
So if you have not switched back to original Medicare, either during the AEP or that disenrollment period from January 1st to February 14th, then you will not be eligible to get a supplement, because a supplement or Medigap policy does not work with a Medicare Advantage plan. It only works with original Medicare. The supplement pays the other 20% that original Medicare doesn't pay, and then you will need a standalone drug plan.
And that's, if I have a supplement or a Medigap plus original Medicare, I still need to be researching my Part D plan during this period of time.
Right.
That decision needs made, and when I look at the Plan Finder tool, I'm going to be looking at just Part D plans and not MAPD plans.
Correct.
Okay. I asked that question because when I was helping a family member go through this process, that was a basic that was not understood originally. So it's certainly a complicated process, but there are kindly people. And how many volunteers do you have that are helping?
We have approximately 50, and some of the volunteers work at outreach sites, and we don't have a tremendous amount of appointments available, but if you call early during the annual enrollment period to make an appointment at one of those outreach sites, if for some reason you feel you need to meet face-to-face with somebody other than over the phone, in 95% of the cases we find that multiple phone calls, which is usually necessary, works just as well. But there are some people's limitations that make it better for them to have a face-to-face appointment. And you can call the senior helpline, and they will give you the location and the telephone number of where to call to make an appointment for those things.
Okay, and again, throughout both segments of the show, we will run that 1-800-96-ELDER toll-free number where you can reach the helpline. We're going to take a short break, and then we're going to come back and talk more about what Shine does even beyond this period, because I know you're busy all year long, and people have Medicare questions all year long. I hope you'll join us after the break.
James is 70 and a writer whose joint pain has been a story in itself. His doctor prescribed a new medication that may not be affordable, even with James's Medicare Part D plan. James called Shine. Shine volunteer counselors can guide you to money-saving prescription assistance programs, including a program that helps pay Medicare Part D plan costs for limited-income seniors. Shine costs nothing but could save you time and money. More information is available at 1-800-963-5337.
During the first segment, we have been discussing the SHINE program that assists Medicare beneficiaries to make informed decisions about Medicare and other health insurance issues. Rejoining us for this segment is Charles Frankel, our local area coordinator, and Janet Mills, our SHINE area coordinator. During this segment, we will learn more about SHINE and also talk some about the importance of volunteers to the SHINE program. So during the first segment, we talked about the annual election period. Something else that seems to come up at this time of the year is the donut hole. Janet, explain to us what the donut hole is, and then maybe Charles can pitch in and tell us how SHINE volunteers assist people who are in the donut hole.
Right. The donut hole or the gap is a term used for people who have Part D drug plans, who have reached their maximum, not their maximum out of pocket, but they have reached this $2,950 portion of payment between the drug plan and themselves, which makes them now have to pay 48% more. The government is currently covering 52% of that donut hole cost. And then until they reach catastrophic coverage. You can probably add a few other things to that.
Yeah. Well, basically, people just find they're suddenly paying a lot more for their drugs because they have very expensive drugs.
Okay.
And so when the total expense has reached a certain limit, as Jan said, I believe it's $2,950 this year, they find that their copays go up. And if they have expensive drugs, which they probably do if they've reached the donut hole, it could go up significantly. Okay. And so there are some things they can do. I mean, if they have low income, they may be eligible for help from a program known as low income subsidy or extra help, which is a Social Security program. Okay. And this will essentially eliminate the donut hole and lower their costs overall. So it's an excellent program, but it is income based. We can help people apply for that. Also, there are things, manufacturer's assistance programs, which may help people who have, or once they're in the donut hole. And these are not mandatory by the manufacturers, so they may or may not be offered for a particular drug, but we can help people research whether or not they exist. And that's a higher income level usually for people, so if you don't qualify for the LIS, you may qualify for one of these programs.
Oh. Am I correct that the Affordable Health Care Act, one benefit of that has been it's closing a bit this
That's correct.
Donut hole?
Yes, as Janet said, this year for brand name drugs, you have to pay 47.5% of the retail price when you're in the donut hole. It was originally 100%.
So a significant reduction in the consumer
Next year, it's going to be the same. Generic drugs, it's going to close a little more. It's a little different for generic drugs. And over time, it will be reduced until it's eventually 15%, 20%, 25.
Right.
Anyway, it's
By
down to almost what the
2020.
normal copay would be.
So it's
but it's going to take
reducing the
a few
burden
years. Yes.
for those who have expensive drugs. You've mentioned low-income subsidy program, which is a very important program to provide some financial assistance for those who are lower income towards middle income. There's another program, the Medicaid buy-in program or Medicare savings program, Janet, that also can assist Medicare beneficiaries in a different way. Tell us about that.
Yes, the Medicaid buy-in program can assist beneficiaries to have the state pay their Medicare Part B premium for them, which normally comes out of their Social Security check, and which is currently $104.90 a month. So if you're within the income and asset limit to benefit from that, we can help you apply. That adds up to a lot of money over a year's time.
Certainly, and it's just a matter, again, of calling the helpline and speaking with a SHINE counselor, and they can review the eligibility criteria for these programs and assist with the application. We have so many people who do call our helpline who don't consider themselves low income, but because of the economic times, their budgets are not stretching to pay for their food and their rent, and it's important. Our helpline does try to explore with them their eligibility for programs such as this that might save them the cost of over $100 for their Medicare premium each month. So that's very important. Tell me some of the other ways that the Shine counselors are able to help throughout the course of the year, because I know you're busy, you're getting calls on a number of subjects. What are some of those, Charles?
Well, especially for people who are new to Medicare, not just choosing the Medicare plan, but actually how to enroll in Medicare, if they have an employer plan, should they enroll in Medicare?
Okay, so this is someone who's approaching either 65 or who has received a Social Security disability payment
Correct.
for, is they're approaching 2 years.
Yes, and then there are some people, unfortunately, who did not sign up for Medicare when they were first eligible.
Okay.
And there are only particular times when they can sign up. Of course, Social Security is the place that signs everyone up for Medicare.
Okay, so you're not doing that piece of it, but you're helping
No, but
them
we can certainly
sort
direct
out.
them and give them the information on when and how they do it.
Okay, and that's so important. What about the person who has Medicare, everything's rolling along okay, and then they find that they've hit a certain medical situation and their plan's not going to cover it, or can you help them sort?
Right. Sometimes they do have some government help already. Sometimes we can make them eligible for government help by helping them to apply. And then they have the option then of changing their plan during the year, not just during the annual enrollment. So they could go to a different type of insurance vehicle that would be better for what their needs are currently. And that's a wonderful thing. To help people. Sometimes people don't realize that there are other ways of getting their drugs, like Charles mentioned, and that helps a lot.
There's not.
I was going to say, there also, people do have problems sometimes, disputes on bills or other things.
Okay.
And we can help them look at that. Sometimes it's just a matter of clarifying that, yes, you are responsible for this, and this is why, and that's fine. Other times there are mistakes or there are things we might be able to help them do.
It's so important to have an unbiased resource to help make these decisions, and the decisions is the consumers, the callers, and one option might be the right option for you and not be the right option for me. So it's a matter of talking with them, understanding their circumstances, and then discussing with them some of the choices. But they make the choice, correct?
Right. The choice is always theirs.
Okay.
We're the educators, and what they do with the information they receive is entirely up to them. A Shine volunteer should never tell a client what to do.
Okay.
We should help them.
There is some confusion out there as the healthcare marketplace opens up, and it's starting on October 1st. What is the impact upon a Medicare beneficiary as this rolls out?
Well, we have been told that if someone is already enrolled in Medicare, they do not need to contact the marketplace at all. They're going to be dealing with their Medicare resources during the open enrollment period.
Okay, so they should be talking with the Shine program, with the Shine counselor. But for people who don't have Medicare, it's very important that they talk with the healthcare marketplace, with the navigator, and we will be running the information. There's a very good website that is set up that they can start to access, but that generally is not for the Medicare beneficiary. They're going to spend their October and November looking at their options within the Medicare arena to make those decisions. We've talked about this is a volunteer-operated program. There is a structure at the Florida Department of Elder Affairs and certainly the Area Agency on Aging, but generally it is the volunteers who are receiving the education and providing that education, the research, the information to the consumer. How does one become a volunteer? Where does that start if someone is interested?
Well, again, it goes back to the senior helpline, and they call and express interest in applying, and then they will be put through to the proper person that can help facilitate that process. They will be interviewed. There are criteria that need to happen, and then they will be given a lot of education and a mentoring process. And so this is a program for the common expression lifelong learners, people that have a lot of desire to help people and the patience and want to learn all of the new processes that come along, this is the program for them. It's a wonderful program.
And so important. Charles, again, like Janet, you've been involved in this for quite a long time. What is the most rewarding aspect to you of doing this work?
Oh, well, I mean, certainly you get a lot of gratitude from the people you help. And then, I mean, as Janet said, it's for people who like to learn. And every day there's something new we learn, sometimes relearn. But it's for people who enjoy learning and helping other people. And both those come across very well.
And generally, a person is going to need to commit at least 4 hours or more a week in order to do this. It's not an easy in and out volunteer role. It's constant education and a commitment to be working with consumers, either on the phone or in person.
And we do a lot of outreach to help people to know about our program. So our volunteers give a lot of presentations and participate in a lot of health fairs, and so that's a whole other aspect of the program also. But we like to train our counselors to participate in all of those programs if they wish to.
And again, in case our viewers missed it earlier, Pasco and Pinellas County has the Corps of Volunteers that has been awarded the statewide award for 2 years in a row. You really have actively engaged volunteers and doing a quantity of work, and I think we're most proud of the quality of work that is provided. And you both are mentors in that program, which is part of the training, that it's not just classroom training, that a mentor is assigned for, what is it, six sessions?
We like to make sure someone is comfortable doing it before they are cut loose. But no one's ever fully cut loose. There's always backup.
It is a team that it is enjoyable working in the office with the team of Shine volunteers, because there is this energy about them, enjoying conferring about a complicated case and figuring it out and seeing different viewpoints. I thank you so much for what you do in the community. You give tirelessly of your time and your talent, and for sharing it today with our viewers. And I thank our viewers for joining us today. I hope this information was of interest to you.
Sarah is 64 and loves to garden, but recently her health insurance ran out, leaving her worried about more than just weeds. With pre-existing health conditions, Sarah's chances of finding good coverage were low. So she called the Elder Helpline and spoke with a Shine volunteer counselor. The Department of Elder Affairs Shine program provides free, unbiased counseling on health insurance for those on Medicare. More information is available about Shine or how you can volunteer at 1-800-963-5337.